Welcome back to Barton EMS Education for the EMT, preparing for that Module 1 exam. This is going to be Anatomy and Physiology and Pathophysiology, PR8 and PR10 with the Kansas Board of EMS standards. So let's quickly go through anatomy and physiology, and then we're going to discuss pathophysiology, basically how the disease processes are working on the body. So we're going to go through some quick overviews. So what is anatomy? Anatomy is basically, to break it down, anatomy means to cut open, to open up the body, to look at what's inside the body. Physiology is how everything is working inside the body. Now, when we talk about listing and describing all of the different anatomical planes, we have several different planes, and we're just going to hold off on that until we get to the medical terminology chapter. But that is part of dividing the body into a left and right, into a front and back, and top and bottom. There are three different types of muscles inside the body. That is smooth muscle, skeletal muscle, and cardiac muscle. Some are voluntary, some are involuntary. But understanding that there are three different types. One that is involuntary, that you can't tell what to do, is the heart muscle. Our heart muscle, as much as we want to say we love other people, we're going to use our heart to extend love, well, you can't. All right, there's three types of muscle. Skeletal muscle, you can make a muscle. Woohoo, look at you, go. And then we've got smooth muscle. That's where your bowels start cramping and you got to go to the bathroom. And then your final muscle, that cardiac muscle, where it's beating out of your chest when you see a really pretty girl walking down the street, or guy, depending on who you are. There are differences with the adult and pediatric airway, and we need to understand those differences. Specifically, when we talk about the one of the big differences is the tongue. The tongue is the most common airway obstruction, and in a pediatric airway, the tongue is much larger than what it is in the adult airway, but it's still a common airway obstruction. The epiglottis is more floppy in a pediatric airway, and the pediatric airway is more of a cone than a cylinder in the adult airway. Cone in the pediatric, cylinder in an adult airway. And so it's very common for a pediatric to have obstructions in their airway. There are two different types of nervous systems. You have your central nervous system and your peripheral nervous system. Your central nervous system is the brain and spinal cord, and then your peripheral nervous system is everything else. And then we also have the two responses that come from the nervous system, and that is our sympathetic response and our parasympathetic response. The sympathetic is the fight or flight, and then the parasympathetic is the feed and snooze. Oh wait, no, feed and breed. Okay, so we have the parasympathetic nervous system and we have the sympathetic nervous system, and those are our two responses. So understanding those two responses and how they physiologically affect the body, how the body responds when those systems are kicked in. You know, are the pupils dilating or are they constricting? You want to make sure that you understand those differences. Specifically, you're not going to want to go to the bathroom when you're trying to run away, so the gastrointestinal system is going to shut down in the fight or flight system. But when you're trying to feed and breed in the parasympathetic system, you want to make sure that you go into the bathroom. Otherwise, you're going to start having all that food start to all the way up to the mouth, and it's just going to start coming out. So we want to make sure the systems are working. So number 10, what happens to the body during the fight or flight response? Make sure that you understand the different types of signs and symptoms that are affecting. What happens to the pupils? What happens to heart rate? What happens to blood pressure? All those different types of responses. What is glucose and what is insulin? What is glucagon? All of these are dealing with the pancreas, dealing with the liver. And what is glucose? Glucose is the various basic form of sugar that we need inside our body to give us energy. And ATP is in that very basic form, but glucose gets broken down into ATP, and then we have all these different byproducts that come off of that. Insulin, does that increase or decrease blood sugar? What is that again? Oh yes, insulin decreases blood sugar, glucagon increases blood sugar. Insulin decreases, glucagon increases. Glucagon and insulin are both naturally occurring hormones inside the body coming from the pancreas. So when we have issues with diabetes, someone's particularly a type 1 diabetic, their pancreas doesn't produce insulin. And so it's really hard for them to regulate their sugars because they're staying up here. So they've got to take insulin from the outside, introduce it inside their body to bring their sugars down, because glucagon naturally wants to work the opposite direction and keep bringing their sugars up. Describe a few functions of the skin. The skin protects us. It thermoregulates us, meaning it regulates our temperature. It also helps us cool down. It also hydrates the body. It protects it, gives it a waterproof layer. We've got a pretty cool wetsuit on our body already when we go swimming in the ocean. What is homeostasis? Homeostasis is that teeter-totter, that if one side tips down or the other side tips up, we're making sure that when we're tipping up, tipping down, we're keeping it nice and level. So if you get cold outside, you start to shiver. If you get hot in the summer, you start to sweat. So homeostasis is maintaining that regulatory balance inside the body. And, number 16 describes a scenario where homeostasis in regards to temperature and how it affects the body. So you're going to have to explain that. Number 17, what are the components of the air we breathe in? So everybody take a big deep breath in. We took that big deep breath in. We filled our lungs up with all that air. And what's our components of that air? Well, 21% of that is oxygen. 1% of that is all other products. And then 78% of that is nitrogen. Nitrogen helps produce surfactant for the lungs and allows us to keep those alveoli open and prevent that shutting of the alveoli, the collapse atelectasis. The two gases we exchange and blow off, we breathe in oxygen and we exchange that with carbon dioxide, CO2. Aerobic metabolism produces energy, ATP, and its byproduct that comes off of it, the waste product, is CO2. However, in anaerobic metabolism, we still produce ATP, but not as much. We're still producing energy, but we're not using oxygen. That's your big difference between anaerobic and aerobic. Aerobic uses oxygen, anaerobic doesn't use oxygen. When your muscles are really crampy afterwards and you're just like, oh, my muscles hurt, that's lactic acid buildup inside your muscles because of anaerobic metabolism, because oxygen has not gotten to those tissues. And so that buildup of lactic acid then has to be taken care of by the lymphatic system, and you have to get rid of it, but the production has still been energy. And the bones of the pelvis, what bone do you sit on? So know the bones of the pelvis, your acetabulum, your pubic symphysis, but also know what the bone you sit on. And what is that bone? Man, sometimes I sit on my butt so long I forget what that bone is. Oh, that's the ischial tuberosity. The ischial tuberosity is the bone we sit on, and that's going to come important when we start learning about hair traction splints much later on in the course. Ligaments connect to what, and tendons connect to what? Remember, ligaments, long bones, bones to bones. So ligaments connect bones to bones, tendons connect muscle to bones. Okay, so when we want to make muscles, tendons, when we're tightening up our muscles, that is tendons. When ligaments are connecting, that is bones to bones. And so that's kind of the rundown of anatomy and physiology. Now we're going to quickly talk about pathophysiology. Well, welcome back. I hope I didn't lose you through the first part on anatomy and physiology. This is the review now on PR10 with pathophysiology. So basically, what is respiratory distress? Respiratory distress is when we have compromise in the respiratory system, when we have a rapid respiratory rate, when we have decreased tidal volume inside breathing, when their oxygen saturation is starting to drop. That is when they start to go into distress. Think of depression and failure to thrive. When someone's depressed, just the body system is not wanting to work properly, but they're not dead. Where respiratory failure is that failure to thrive and everything's just starting to shut down. Where respiratory arrest is completely dead. So think about those things when we talk about respiratory distress and respiratory failure. But when you have to look up the signs and symptoms of respiratory failure, don't forget to go back to that Merck manual that we use in the EMS class to always define things What are the signs of symptoms of respiratory failure? Is it the oxygen saturation? Is it the respiratory rate? Is it the lung sounds? Look up those signs and symptoms of respiratory failure. And what is hypoxia? Hypoxia is that low oxygen. Just because someone has a low oxygen saturation doesn't mean they're hypoxic, but when we have that low oxygen that allows the body to not have enough oxygen to do its functions, that's when we start to go in hypoxia. And, what's that average tidal volume of an adult male? That's a good thing to look up and understand for the test. The average tidal volume that you see for an adult male is about 500 milliliters. So the average tidal volume is 500 mLs. What's in our BVM? Approximately 1,200 milliliters. So why that huge difference? Well, sometimes people need more milliliters of volume because they're in respiratory failure and respiratory distress, and we've got to have that gas exchange happening. So they're going to need a little bit more of a ventilation. But realize this, when do we ventilate someone, or how do we know we're ventilating properly, is we ventilate till we see chest rise. So we want to make sure that we're seeing that chest rise. And then we also talked about what is a chemoreceptor. Chemo comes from the word chemical, and receptor is a site that has a response. So a chemical stimuli that changes on the cells or the organs because of sensing is a chemoreceptor. So a change or response from a chemical stimuli on the cells or the organs is a chemoreceptor. And one of those chemoreceptors we have is CO2. And CO2 helps regulate our breathing. Not so much on oxygen. When you don't have enough CO2 in your body, or you have too much CO2 in your body has a response. And one of those, when you have too much CO2 and you need to balance out that homeostasis, is you go and you yawn because you're taking in more oxygen in the air you breathe, because a chemoreceptor in your brain says, hey, there's too much CO2, we need to take a breath. Hey, dummy, take a breath. And that's what I need to do sometimes because I get talking so fast. Now, what's the definition of shock? Now, my definition of shock and what the proper definition of shock are two different things. So make sure you're looking at the proper definition of shock. But what's my definition of shock? Inadequate tissue perfusion. Okay, hey, what's that next question down there? What are the effects of inadequate tissue perfusion? Remember to go back to your Merck manual to look up shock. But what is the definition of shock? The definition of shock to me is inadequate tissue perfusion. When the tissues are not getting properly perfused with oxygen, they're not getting the nutrients, they're not getting rid of waste products, they're having buildup of lactic acid. What is perfusion? When the tissues are getting oxygen, they're getting nutrients, they're getting everything they possibly need to function properly. What is hypercarbia? Hypercarbia is increased CO2. Carbon, C is carbon, pertaining to increased carbon. So we're talking about increased carbon dioxide. Number 11 was the formula for cardiac output. Cardiac output equals heart rate. Your heart rate times the squish, the stroke volume. So heart rate equal times stroke volume equals cardiac output. Again, that's cardiac output equals heart rate times the squish, the stroke volume. So if 2 times 2, what is that going to equal? 4. So your cardiac output would be 4. So in homeostasis, where everything's normal, 2 times 2 times put that together, we get 4, and that's your cardiac output. If there's a change in your heart rate, it goes up, we're going to have to decrease the other to keep it homeostatically balanced. And that's what we call compensated shock, when the heart rate goes up and the blood pressure normally stays about the same or goes lower to maintain that compensation. When it becomes decompensated, that's where the heart rate's gone up, the blood pressure's dropping, or the heart rate starts to drop, and we're decompensated. We're not maintaining homeostasis at that point. What is the difference between sympathetic and parasympathetic nervous system? We've discussed this already, so refer back to the previous videos. And what does systolic mean, and how does it relate to blood pressure? Systolic is the pressure inside the heart when the heart squishes, when it's working. It's the pressure inside the heart. So when you get that first blood pressure and you say 120 over 80, 120 is going to be your systolic pressure. It's the pressure the heart has to work against to push out. and that's 120 millimeters of mercury. And then the next question will be, well, what's diastolic? Diastolic is the heart at rest. So when the ventricles are at rest, that is diastolic. Hey, look at that. Number 14, what is diastolic? So we've already answered that. What is systemic vascular resistance? It's the amount of pressure that is being exerted in the system through the vascular network, providing that pressure for things to return back to the heart and providing that pressure for things to go out, and the pressure that the heart has to overcome. If there's less systemic vascular resistance, meaning the vessels are not really big, we have to make sure that the heart's not going to have to pump as hard. But if the heart's pumping really hard and we don't have a lot of systemic vascular resistance, it's going to cause issues in the body, and that's what we talk about with distributive shock. What does constrict mean? That means when the vessels go and they tighten down. And how does it relate to systemic vascular resistance? It increases systemic vascular resistance. What does dilate mean? It's when the vessels go woo and they get really big. And how does that relate? It decreases systemic vascular resistance, which affects the heart. What are the products of aerobic metabolism? One of the products that we talk about is ATP, and one of the waste products is CO2. What are the products of anaerobic metabolism? Again, is ATP, and CO2 is a waste product. Now realize in both of these, they're both products, but more ATP is created in aerobic metabolism and more CO2 is created in anaerobic metabolism. When we have CO2 exchanging with fluids in the body, we get lactic acid. Okay, the next section we'll be rolling into will be PR11, talking about lifespan development, and we're also going to talk a little bit about medical terminology as well. So stay tuned for those sections to prepare yourself for the Module 1 exam for EMT.